Namaskar everyone. My name is Dr. Manish Yadav and I welcome you all to my Homeopathic Learning YouTube channel. So, what are we going to talk today? So today we are going to talk about, and basically I'm going to share with you a case of fever. Now, managing fever is something which is very close to my heart. Why? Because fever, when you manage fever, and especially when you manage fever in children cases, it boosts a lot of your confidence. Number one. Second, it is a challenging thing because in if you really want to practice and want to increase your practice, it is fevers, is it acute that you have to manage. The day you start managing, the day I started managing, was able to manage these kinds of fevers, then only my practice really started increasing. Even in pathological cases also, it is very important that you should develop this knack of treating acutes. Now, treating acutes is not always, easy going thing. We all know that. How much ever we talk about, but definitely there are some cases, where it takes a lot of your skills and a lot of your churning into mind, and the kind of pressure it builds up because you have to get down the fever, right? You have to treat the disease, and that is what is challenging. And these challenging things really help you to evolve as a practitioner. It improves your clinical skills. It forces you to go and study, to work on yourself. And that is the challenge. These kinds of challenges are what I love in my practice. And this is one of the case which I just treated recently. And I felt like, because I felt like sharing it to my, my all my colleagues, because this case, see, I've been treating patients for such a long time. But in between some time, some patients come, like acutes come, where you also get stuck. So I was stuck in this case. And then I learned a lot of things. There were a lot of my prejudices. There was a lot of my fault which came into my, my prejudices came in front of me, and I was not able to go ahead of this. So I felt like sharing this case with all of you in my entire journey. And you will also see how stupid I was in this case and how mistakes can happen. So I have no problem in sharing my mistake and my prejudices because I want to learn and grow from it. So let's begin the case and let's directly jump into it and let's learn from this case. So we are in the July month, July 2026. We are at the end of the July, basically. So in the first week of July, I got this fever case. I started managing it. So let's look into the case details. A girl child, 3 years of age, came with fever, constant heat. Now, whenever acute comes, if you have looked into my videos, where introductory videos of acute management, I've already spoken about ailments from how exciting cause is important, right? You must have, if you have not seen, you should go and learn from it because to manage acutes, it is very crucial to understand aphorism number 5. What is it Henman talking about in acute disease? How to treat in aphorism number 5? He's saying that we have to look for exciting causes. There is no acutes without an exciting cause. So it is very important to understand exciting cause. So whenever fever cases come to me, especially children's, I always look for exciting causes first. And I have been able to tackle so many acutes just understanding the exciting cause and giving appropriate remedy. So, in that perspective, when I started taking the case, this is how things happen. So, I'm going to share with you the entire chronology, the event that happened. So, patient says yesterday she was playing 8:30. So, 8:30 playing normally. 8:30 p.m. Okay, 8:30 p.m. She was playing normally. She had lunch, dal rice, and then she started feeling a little drowsy. As she was playing, her head was little hot. This was the data given by the mother. And head was hot, little hot. She felt drowsy. She had already taken lunch. And immediately she went onto the bed and she slept. Now, this is very strange for the mother because the child, for 12 o'clock, 1 o'clock, she's running and playing. So, mother thought maybe she's tired. Mother took her to bed and she slept. Around 10 p.m., when checked, she was in fever. Measured 100 degrees. Fever was around 9900 degrees. Now, fever was rising gradually. Head became very hot. The neck also, mild heat in abdomen area also. Extremities were normal. So this is how fever was coming. Head was hot, then face, the neck, abdomen, mild, extremities normal. But she was in deep sleep. She was sleeping. Continuously she was sleeping. Mother said we woke her up. As she woke her up, she started complaining of pain in abdomen. Just remember she is just 3 years of age. The child is only 3 years of age. And she started crying and saying something is happening in abdomen, pointing pain in the abdomen. She asked for water. Little water was given. She drank little water. As soon as she drank little water, pain in abdomen increased, and immediately after maybe a few minutes, she vomited. She vomited. Vomiting consisted of the water that she had taken, or and the food also, which she had just taken, 1-2 hours before, that dal rice and everything. All things came out. So now when the patient came, first thing is I thought that yes, definitely the problem is in abdomen. There's some kind of infection happened. So first thing I have to inquire, is there anything that she has eaten up? So that is the first thing that you think about, especially in children, to understand the exciting cause. So I started asking about the routine of the entire day and the previous day just to find out the exciting cause. Now I'm here not going to go into the case taking part, how you go back and ask, but yes, you have to go back and ask. You have to understand that what is happening right now is important, but what has happened and how it has happened, why it has happened is more important than what is happening. So events, we have to understand the events. Afternoon time, she had bun pav maska. Some, there's a bread like pav and there is a butter, cheese in it, basically. So we get this bun pav maska here in India. So it's a cheesy item, cheese, butter, and pav, basically. So fatty food, you can say it is a fatty food. But other than that, no history of getting wet, no exposure to heat or cold exposure, no exact cause was not. Only she had bun maska pav, which I felt maybe a fatty food, but she had it in the afternoon, right? And this gradual fever came. In fact, head was getting hot from evening only. Mother later confirmed that I felt her head was little hot initially, but it was not. I thought it is normal. So only thing which I could understand, I could speculate rather. I was not sure, but I would speculate that maybe this fatty food had aggravated. So this thing got into my mind. Okay. But other than that, I could not find any of the exciting ones. Now fever was rising gradually, till around, but it used to be around 100 only. This was also very important phenomenon. Now there are certain fevers, which rise suddenly, which rise gradually. There's insidious progress and there is a acute progress, rapid progress. This was an insidious progress. Fever remained, now you'll see in the case. I managed this fever for consecutive 3 days constantly. Fever never went, like in between it went few times 102, but it was gradual beginning and it used to remain 9900, 9900. Then it used to slowly become 101. That's how the fever was rising. It was very gradual process. What was the behavior during fever? So what happens now when we come from why it happened, when we come to what, then we have to understand the behavior of the patient. What are they doing? So many things they can do. With the pain, so many things can be done. Patient can laugh, patient can cry, patient can yell, patient can become cranky, irritable, carry desire to be. So many things are there. So what was her behavior during fever? Lie, desire for and mourning with pain. So constantly she just wanted to lie down. As I told you, 8:30 fever rise. What she did? She went to the bed and slept. So lie down, inclination to lie down. There are rubrics like ogre fever, inclination to lie down, and sliding down the bed. There are some rubrics that you can think of. And there was little mourning with the fever. Now, mourning with pain. It was not that characteristic, let me tell you. This was what mother said. She says, but it was only gradual because, of course, if there is a pain in abdomen, child will moan. When you can take this symptom, morning with fever or morning with pain, when it is a constant phenomenon. It was not constant. The constant phenomena was sleepiness. She was excessively sleeping. But at that time, this was my first consultation, first time. So I was just noting down everything what mother was giving history. Sleeping was excessive. She said she sleeps a lot. Carried desire to be slowly. Very clingy. She wants somebody close by. But somebody is close by, then she goes to sleep. And she wants, if she's woken up, she wants to be carried. And how she wants to be carried? So I've written down, carried down slowly. Means just somebody should cuddle her and just cuddle her and take it like this and maybe very slowly. You just keep it on the bed or you walk slowly. It is not like this. Carrot desire to be fast, like arsenic. There's one symptom. You know, chamomilla carrot desire to be or carrot desire to be on shoulder. No, very slowly. Just want to be handled. That is carrot desire to be slow. That's what I interpreted. Thirst less. Mother said no thirst, but I thought maybe this is because of the pain in the abdomen. The child is not drinking. This was my doubt. Now, on this data, what is the remedy that you can think of? So that was the only data that I got. So the number one thing what I did is, first thing, the most characteristic thing, which I felt this could be the most characteristic thing was morning Morning fever, partial heat, head beginning on. So when you go and see, because fever first started in the head, and from head it started going down or another part of the body. But when you go there, there are only three remedies. Aconite, one more remedy I forgot, and opium is there. But I was very reluctant to give aconite because of the violence. And opium, I was really like thinking, shall I give opium? Like opium, I didn't thought of because opium is a big remedy. There are so many other aspects of it. The mentality, the cause, a lot of things are different. And here I got stuck. This is where I really got stuck. So at the end, we'll come back to this point and we'll see what happens. So looking at this, so I thought, okay, fatty food aggravates, kind of thirstless, carry desire to be, she's not complaining, easygoing child, kind of thirstless, morning. The remedy gave was pulsatilla. But I was not happy with this pulsatilla because I knew that the symptoms which I have taken, I was very doubtful whether these are really characteristic symptoms or it is a common symptom. So what happened? Next morning, nothing happened. In the night only pulsatilla was given, whatever short data I got. So next morning, second day we are in. So 10 o'clock, 8:30, 10 o'clock fever rose, whole night fever. And they were sponging and they were, doing all this stuff. No, not much relief. Again, so when you fail, what do? You reanalyze. There is some problem, some things you are missing. And what are you missing is the only thing that a homeopath misses is differentiating between common symptom and a characteristic symptom. A symptom which is characteristic in one patient can be common in other patient. Always remember that. Fever 101, gradually it is increasing. Head, face, neck, abdomen hot, extremities cold. Descending fever. Fever is coming head, face, neck, abdomen. So it is descending. There's a rubric, descending fever, ascending fever. We have rubrics like that. Thirst only when she wakes up and little quantity she is taking. Lie designed for slides down in bed, vomiting once, pain in abdomen, sleeping, excessive sleeping, lips dry, mouth dry. So I repertorized. Morning was fever, partial heat with cold extremities. Fever, heat on head, face, neck, abdomen, mouth. So this is Bonning-Austin method. You take one symptom and you repertorize. Dryness, lips, mouth dry, lips dry. Generalities, lie down, inclination to, and excessive sleepiness. Uncovering. There's also one thing, she's lying down, but she doesn't want covering. Uncovering with inclination. When I repertorized, I came to arson. Now here there is something very important to understand. So Arsenic, when you read arsenic, arsenic is a remedy where the ailments from is from, you have to understand ailments from. Ailments from is what? Is contamination, number one. Second, they get exposed to contaminated food or water or something. Second is having cold things, ice cream or cold drinks. Then they get aggravated. All those things were not there. When you look for other aspects, what pointed towards arsenic, which I thought maybe I can give, is arsenic fever or any acute comes with complete or not complete but profound exhaustion. What does that mean? Profound exhaustion means the exhaustion is disproportionate to the disease. 1 day fever, 2 day fever, patient is so weak that it feels like 10 days fever. 1 or 2 times he has passed motion, it feels like the body is so much drained, it feels as if the patient has passed 10 motions in a day. So profound exhaustion. That is why the rubric slides down in bed. Arsenic and muriatic acid. There are only two remedies. So I thought maybe this could be an arsenic picture because she's lying down, she's sleeping. Now she's just 3 years of age. How can now I can't ask her, are you feeling exhausted? Are you feeling weak? What? She's just sleeping, sleeping, sleeping. So I thought maybe she's sleeping and she's just want to go into the bed because she's very much exhausted. And then lips dryness and other features of it. This looked better than my pulsatilla prescription. It is said, when totality matches, that's great. But I was still not sure to give arsenic. Means I had something in my mind. What was in my mind is few aspects I was in doubt, and also her ailments from. Okay, the exciting cause was not there. So I thought maybe let's give the remedy and see. So I gave arsenic. One. What happened? No relief. Second time I failed. And as a homeopath, when you fail in fevers, you don't have too much chances to experiment. Okay. And you have to be very vigilant. And that is why that is the reason where I continuously, whenever I am with any fever patient, I tell them, please keep informing me. I try to be in a constant communication with them, 3 hours, 4 hours, or 3 times, 4 times a day. Because you have no idea when the symptoms can change. And when symptom change, or forget about symptom changing, sometime for you it takes time. When fever is in full blown, it takes time to understand the real picture of it. This is what was happening with me. My arsenic failed. By the time we are in on the third day, means 2.5 day, the night, then next day, and we are on the third day. Okay, so approximately third day in sequence, but night part whole day, 24 hours, and we are just in the first half of third day. In between, definitely ibugesic was given. I will not shy away from this because when you're managing children cases, of course, when fever goes above 102, I tell my patients that if fever goes above 102, you keep doing sponging, and I explain them all the aspects of fever, what has to be done. But it goes 102, you can give ibugesic because it is for the panic of the patient also, like relative. And I don't want fever to rise 102, right? So in between, you can use paracetamol, ibugesic, because it is my problem. I'm not able to find the symptoms. It is not homeopathy. And also I get to buy some time. So this is what I did. And I'll tell you, this is not a good feeling, when I have to say to the patient that you go and take this allopathic medicines. I never feel good. None of the homeopath feels good. So you can understand what trauma I must have been going through. Now this is the challenge basically. And constantly, I'm thinking about the remedies, arsenic, pulsatilla, gelsemium, all the remedies I'm thinking. It's not just I just gave the remedy and I'm sleeping. No, I'm seeing my patient, but that patient is in my mind. I'm trying to understand. I don't know. I can't tell you how many times I have repetized here and there. This is few repetization I'm showing you. So this case is not to show you that what great prescription it was. This case is actually to show you that this is the tussle that every homeopath goes through. I go through. Many times on first shot you don't get it right. So we as a homeopath, we should also discuss and share our failures where the mistake happened. That's how you develop your clinical skills. In between, belladonna was also given out of sheer desperation because head hot and all those things. But I knew this is also not the right remedy because the genius of belladonna was missing in this case. Sudden acuteness was missing. So it was just given one dose, but it was just out of frustration, desperation rather. Now, is there a time to shift to allopath? This is a very big, tussle. Shall I send it to a pediatrician or a general practitioner? Homeopathy never fails. It's the homeopath that fails. Remember that. So again, I started reanalyzing. I said, no. I'm missing something. I'm missing something. I'm really missing something. Then I wrote down few aspects of the case again. I said, I always want to focus on the exciting cause in the acute, but in this case, the exciting cause is unclear. So whenever anything which is unclear, you should never take it. It has to be very clear. Like I took that bun maska pav fat desired for, but fat food aggravate. But was I really sure that fat food had aggravated? I am not sure. Arsenic I gave, was there exciting causes? Were they arsenic exciting causes like contamination and cold drinks? It was not there. Belladonna exposure to cold and suddenness. It was not there. So exciting cause was unclear. So I said to myself, now whenever I analyze the case or think of a remedy, forget about the exciting cause in this case. I'm not saying that exciting cause is not there, but I am not able to explore it. It is my fault or patient sometimes they're not so vigilant enough to see what has happened. Definitely there has to be an exciting. So, but to analyze now, I should keep this aside. How is this pattern of fever? I asked, how is the pattern of fever? I've been observing child. This is my third day. How is the pattern of fever? So it is low grade and it is gradual increase. So I said to myself, now I will take only those symptoms which are sure symptoms. Because at least in 2.5 days or something, I've been constantly observing the child. Few aspects are constant. See, few aspects are here and there. Like thirst, sometimes she drinks, sometimes she doesn't drink. Oh, she's thirsty or thirstless. Now this is doubtful. So throw it away. What is constant? So constant number one was the pattern of fever. Low grade and gradual increase. Number one. Starts with head. This is very, very important. And always, I've also observed, mothers, everybody observe. Starts with head. Head gets hot first. Then face, neck, abdomen, extremities remain cold. So descending fever. Fever is descending. So this is two symptoms I got. 2 or 3 symptoms, right? What is she doing during fever? She is sleeping. How is the sleep? It is very, very deep. She actually literally goes to sleep. It is like stupor. It is not gelsemium sleep. It is stupor. Also, not passed stool since 3 days. So I wrote down, maybe she is constipated. But then I'm thinking maybe she has not eaten also anything. But still, few things she's been taking, but there is no stool for 3 days. But it was doubtful, so I said no, I will not take anything which is doubtful. Wherever but comes, I will not take. Okay, but she's not eating. So I said, I'll keep in mind, but I'll not take as a symptom. These were the remedies which I wrote down from my mathematical understanding. Arsenic, phosphoric acid, bryonia, gelsemium, antimony tart, nux mos, shut and open. I started differentiating them, reading all the bold italics, exciting cause and all those things, and slowly differentiating them. I asked, whatever is my remedy, what my remedy should have. These are the components that my remedy should have. Gradual rise of temperature, excessive sleepiness, and fever beginning from head, then descending. These 3 components are the most important thing in my fever. Gradual rise, excessive sleepiness, fever beginning from head, and then descending. So new totality I made. Again, now coming to this rubric. Fever, partial heat proceeding from head, aconite, alumina, and opium, 3 remedies. Alumina I read, but alumina symptoms, I don't know about fever, paralysis and all those things, chilly feeling, dryness like bryonia. Aconite, As I told you, aconite is the suddenness, the panic, fear. That panic was not seen. There was no panic, third day into the fever and everybody's cool. Okay. So that is not aconite. Opium was the remedy which I was reluctant to give, because this rubric, the first rubric that actually I saw was this in the beginning. But I ruled it out because I said, no, it cannot be opium. Now, this was my prejudice. This was my prejudice. Because sometimes you have got some drug pictures in mind, some cases you have seen, and you think the remedy could be because of like this one. For example, opium, I thought opium is a remedy, it's a deep remedy, it's a chronic remedy. I've never given in fever. And generally, when you give in fever, long lasting fever, and complaints never kind of things. So I had some prejudice, maybe. I don't know why I just ruled out, opium. So I took these rubrics: partial heat proceeding from head, descending fever, and sleepiness. And then again, when I repertorized, opium. Then it clicked to me, oh my God, this could be opium only. It's a case of opium. Opium. Trios of sleepiness. Nash gives a lot of trios. Trios of sleepiness. We'll see all the trios. The sleepiness trios of Nash is opium, antimonitard, and Nux moscata. Gelsemium is also a remedy, but gelsemium is not for stupor. There is dullness, dizziness, drowsiness, but it is not like stupor. Again, gelsemium has muscular paralysis, weakness, muscles, and the cause is summer's heat, going out, getting heated out, summer's remedy. Reading into the Mater Medica. I went and then I said, let me read Mater Medica and see what is written rather than thinking about my drug picture of my remedy. It is said fever is characterized, opium, fever is characterized by stupor, snoring, respiration, and other things, intense sleep, and sleepiness, excessive sleepiness. And then look at the last line: general low temperature with inclination to stupor. And this was the keynote of my patient. Patient is sleeping, sleeping, sleeping. The child is sleeping, 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 and it is not high rise. I'm telling you again and again, it is low temperature, low temperature. And there was one more thing in there: want of susceptibility to remedies. Second line, I think, lack of vital reaction. The well-chosen remedy makes no impression. Then you can think of opium. So when your main acute remedies like pulsatilla, arsenic, it seems indicated, but it is not in the it's not affecting. Then you can think of opium. There's something very nice. Alan writes down the first line, I think, especially adapted to children. Now I was reluctant to give opium in children case, but the first line he writes adapted to children and old people. So children and old people. Diseases of first and second childhood. Persons with light hair, lax muscles, and want of bodily irritability. Means there's no reaction or susceptibility. But what is the meaning of disease of first and second childhood? Let's understand this. So I googled it and said, let me answer. Let me understand this. The term first childhood refers to the literally first stage of human development, that is infancy and early childhood. So this patient is 3 years of age. So what does that mean? This is the infancy and the early childhood. That is first childhood. Characterized by rapid physical, cognitive, and social growth. Second childhood is what? An informal or sometimes metaphorically idiom used to describe a return of childlike dependency or behavior in older age. When you become old, but your behavior is like child, you are reckless, you work on your own satiety, interest, hobbies, you focus only on yourself, very childish like things you start doing at the older age. So that is also second childhood. There also opium could be one of the remedy. Nash trials of drowsiness. Nux moscata, antimonitard, and opium. Now let's understand the difference between them. Nux moscata, sleepiness is unconquerable and uniquely paired with excessive dry mouth and tongue, but complete absence of thirst. this patient was asking water. She was not drinking water because of fear of pain in abdomen, but she was, whenever she was getting in that 3 days, I observed that she's drinking water. That was the reason, I thought of arsenic. So Max Moschata has absolute dryness with absence of thirst, sleepiness, excessive. And so, like opium, but opposite of bryonia. Antimonitard, the drowsiness manifests as constant heavy disposition to sleep, accompanied by ceaseless yawning, gapping, and respiratory rattling or exhaustion. So it is a respiratory complaint. So if there was some bronchitis or lungs affection or cough, then I would have thought of, and rattling was there. Then maybe I could think of antimonitard. Opium, sleep presents as profound, heavy, stertorous stupor, where patient is hard to arouse and often sleeps with half eyes closed. So this is the difference between all the three. Follow up. So in the evening, 6:30, opium vanam could be given. Fever remained constant 100 till 9 p.m. And I was repeating it every half hour. Then she slept again. Night fever was gradually reducing in reverse order. So next morning, I said, don't disturb and just see. So what happened in the night? Gradually, the fever started reducing. But the best part was it was reducing in the reverse order. Like head remained hot, but abdomen, then like it is going ascending now. Fever is coming descending, it going ascending. Reverse order of appearance. Morning she woke up 98, 99 fever. Only head is hot, but is of less intensity. But the best thing the best thing was she asked for food. And when I got to hear this, that she is asking for food, I said, remedy is right. Don't change anything. Because when generals start improving, patients start improving. So she asked for food. By afternoon, fever became absolutely normal. Now she is absolutely fine. So this was a short case which I felt like, discussing and sharing with my colleagues. You can definitely write comments. You can ask questions. But I just, as crude the case was, I wanted to show it to my community. There's so many things to be learned. I think the biggest learning for me in this case was to get over my own prejudices. We develop prejudices about remedies, the drug pictures, and so many things, some prejudices we have. The constant battle of a homeopath is this only, that he has to first get over his own prejudices. So after the child got better, I was very happy. And of course, when you treat fever, it gives a lot of confidence. I hope this lecture will help you to dive deeper into the cases and give you a confidence that yes, we can do it in spite of some failures that we have. Thank you very much. Bye bye. Take care.